Good day. The YMCA Education Series is free and open to the public, so we encourage you to spread the word and invite your family and friends. We host approximately 6 to 8 of these a month, varying in all types of different projects or topics. This program will last about an hour, and you may find you have questions. Feel free to put it in the chat box, and then we will be able to get to it. You can also hold your questions to the end, and Denise will allow time for those questions. Thank you again for joining us today. I would like to introduce to you Denise Schwartz. She is from the Manual Touch Physical Therapy Expert Advice. Denise is a licensed physical therapist specializing in treating pain using a holistic approach to discover the root cause of pain and provide natural healing options. Today's talk is Heal Low Back Pain and Sciatica, the 3 main causes and how to heal naturally. Welcome, Denise.
Oh, thank you, Pam. Okay, I'm going to share my screen here. Okay, hold on a second. Okay, looks okay?
Yep, great.
All right, I have to do one more thing here. Can you see the little arrow floating around here, the mouse?
Absolutely.
Okay. All right, I am going to close everybody's screen here, including mine. You'll still be able to see me though, right? Okay. All right. So thanks, Pam, for having me at the Y. This is a presentation on how to heal your back pain or sciatica naturally. My name is Denise Schwartz. I'm a physical therapist and owner of the Manual Touch Physical Therapy in Wheeling. I'm at the corner of Milwaukee and Dundee Road, so just outside of the boundary of Northbrook. When I graduated PT school a very long time ago, I knew that back pain was the #1 reason people went to see their doctor. And because of that, once I graduated, I took a lot of different classes, continuing education, to become an expert in treating back pain and sciatica. And I would say these are what we call traditional techniques. And I became very good at it, became an expert, and helped a lot of different people. Along the way, I started studying a non-traditional manual therapy, a hands-on technique called integrative manual therapy. And I found that people that I couldn't help with some of my traditional techniques, I could help them with integrative manual therapy. So I could help everybody with that. I left the hospital I was working at, Lutheran General, and after 14 years and I left with my mentor to start the franchise center IMT here in the Chicago area, and really exclusively doing integrative manual therapy. We saw a lot of people with complex medical and pain problems, people who don't get better elsewhere, people who aren't doing well with traditional medicine, and we helped a lot of different people. 12 years ago in 2010, we parted ways, and I just took over the practice, and I created the Manual Touch Physical Therapy. And what I chose to do is, what I realized is a lot of the traditional things that I used to do, the traditional manual therapies and the traditional exercises were still really good. And so I brought those back. And so now my business is based on using a very whole body approach of traditional and non-traditional therapy to get people back to doing the things they love to do. Along the way, I had become a passionate runner, and so I became an expert in treating runners as well. I do have a little bit of golf knowledge. I see a lot of people with balance issues as well, and some vestibular. But typically, I see people with all kinds of pain problems. Today, we're focusing on back pain. But those of you who have come to some of my talks before, I do one on shoulder pain, hip pain, foot pain. A woman before asked me to do something on knee pain. Maybe hopefully I can get that together. So any kind of pain issue, and everything is connected. So I'm always looking at you as a whole person. Both of us here, I have another therapist here named Kevin. He and I worked at Lutheran General together many years ago. So we both have the same philosophy and skill set. Okay, so one of these days we'll get back in person. When I would normally do this in person, I would ask people in the group, when do you have back pain? What makes your back pain worse? But since it's very difficult to do that back and forth on a Zoom, these are some of the typical complaints. And based on these complaints and people, what they're telling me when they have pain and when they don't have pain, gives us clues as to what's causing the problem. So we're going to talk about typical complaints you might have. We're going to talk about what it possibly might be, what are the three common most issues, and then what do we do about them. So some people talk about how if they walk or stand greater than 10 minutes, they start having leg pain, sciatic pain, or back pain. But sitting seems to make them feel better. And then you've got people who, when they bend over, it increases their sciatic or back pain, and sitting makes it worse, but standing and walking makes them feel better. Some people talk about having pain first thing in the morning, or just general back stiffness in the morning, very stiff. People complain of numbness, tingling, or pain somewhere in their leg or foot. It could be down as far down as your big toe. Some people talk about how it feels like their back needs to be cracked or something is stuck. It may hurt when they just stand on the one leg. May hurt when they cross their legs, getting in and out of the car. So those are all clues as to what may be going on. Right now, to really protect yourself, I have created an ebook here called Mindful Tips for Pain-Free Daily Movement. If you put your email and your name, first and last name, in the chat box, I'll be happy to send this to you, along with a copy of this PowerPoint presentation as well. Okay. So the three most common causes that we will see in physical therapy, this is certainly not all the reasons, but these are the typical reasons that people have back or sciatic pain. The first one would be a herniated disc. Sometimes it's called a slip disc, a bulging disc, a herniated nucleus pulposus. And when people have this, if we see this in on an MRI, and they're having symptoms, MRIs aren't, just because we see something in MRI doesn't mean that's the real problem, doesn't mean you're having symptoms. We are all walking around with some bulging discs. We are all walking around with arthritis in our back, but doesn't necessarily mean we are having a problem. However, when someone has this issue, they will have pain with sitting or bending forward. Those are the typical, when someone tells me it hurts to sit or bend forward, this is what I'm thinking of. The second most common cause, and this is typically in younger folks, probably under the age of 50 or so. Usually after age 50, you've already had the herniated disc, it's calmed down. But if you have pain and you're older, it's usually arthritis, although I do still see some of this. The second most common cause is stenosis, also known as degenerative disc disease, and it's a type of arthritis. Stenosis means a narrowing, so the spinal canal has gotten narrower. People with this have back or leg pain with standing or walking, particularly after 10 minutes or so. The third most common cause is the sacroiliac joint pain. And people with this issue complain of pain laying down on their back, or they feel stuck. It probably hurts to cross their legs or get in and out of the car. I would say here, and I think I need to change this talk to four most common causes: postural weakness and immobility, inflexibility. Everybody who has one of these diagnoses will have postural weakness and immobility. However, we will have people with back pain and they don't have any of these common causes. They're just weak. Weakness of your muscles that you need to use on a daily basis to stay upright will cause you to have pain when you fatigue, if your endurance is low and your strength is weak. People who are very stiff and rigid and don't move very well are inflexible. Our technical term is immobility. What happens is then they overuse certain other areas and then they get pain there as well. This postural weakness is where I see a lot of younger people, teenagers, people in their 20s. I've had kind of a slew of young women who, you know, they graduated college and now they're sitting at a desk all day long working, or they've been at home for the last 2 years, sitting on their bed, bending over and working. And as a result, their back muscles and their core muscles have gotten weak. So let's talk a little bit about anatomy, and we can come back to talking more about those. Okay. This is a side view of your lumbar spine. This is, so your spine is made up of your cervical, which is your neck, 7 vertebrae, thoracic, which is the mid back, there's 12 of those, and then you get into the lumbar spine. You got this is a vertebrae, L1, L2, 3, 4, and 5. This is your sacrum, and this is your tailbone known as your coccyx. In between the vertebrae are your discs. That's this blue part. Here you can see a hole going through all the vertebrae, and that's where your spinal cord comes through. And then between each vertebrae, there's created a hole or a space. It'll called your facet. Well, these are your facet joints. Oh, foramina, excuse me. These are called foramina. And the nerve comes out of the foramen and goes to the rest of your body. Okay. The sciatic nerve comes out between L4-5, L5-S1. We'll see it better on the next one, and out of the sacrum. And that is the largest nerve in your body, the sciatic nerve. Here you can see it coming out behind your buttocks. Okay, and it comes from here, here, and here. It runs between some muscles and runs behind your butt, down the back of your leg, and it splits behind the back of your knee and goes all the way down to your foot. The disc is like a jelly-filled donut. In the middle of the disc is a nucleus. And what happens when you herniate a disc, it's actually this nucleus is shifted, and it causes a bulging on the outside of the disc, which has a ligament around it called your annulus, annulus fiber. And it presses on that, and then it presses on the nerve. Okay. It doesn't typically press on the spinal cord, but that's actually a serious matter, much more serious condition. But it's usually just on the nerve here. When people have pain in their leg, it's usually an L4-5 disc or an L5-S1 disc. When it's up in here, people just have pain typically in their back around that area. I have had people with a herniated disc just above L1 here. This is called TL joint between the thoracic and L1. And what happens is when somebody acutely injures their back, particularly herniates or bulges their disc, the muscles around your spine go into spasm and clamps down onto your back. And it's actually your body's safety mechanism to protect your back, your spinal cord, and your spine from becoming injured further. Even though those muscle spasms really hurt a lot, they're actually creating this like armor around you to protect your spine so it doesn't get more damaged. So you might think just getting a massage to work on those muscles will help, but it doesn't really get to the root cause of what's going on in the spine. It'll feel good, and it is a nice adjunct to have. This is a view of looking from your back. So here's those vertebrae again. And this is your pelvis down here. Here's your sacrum, here's the tailbone, the coccyx. Your pelvis is made of 3 bones that are fused together. This top part is called your ilium. Down here is called your ischium. This is the back part. This is what you sit on. It's called your sits bone, but it's really your ischium. And then in the front here is your pubic bone. This ilium comes together with the sacrum to create the sacroiliac joint, or we shorten it for SI joint. when people have a problem here, what's happened is this ilium or the sacrum has shifted just ever so slightly. And so what's happened here, right? Muscles here are connected to the sacrum and to your femur, which is the long bone in your thigh, also known as your hip bone, I suppose. And what happens is if you get a little strain here, it kind of pulls on the sacrum a little bit, pulls on the ilium, or pulls on the ilium a little bit, and it shifts it just ever so slightly, and it causes a sensation of like feeling really stuck right in this area. And the way to really take care of this is usually with a hands-on technique. It does settle down after a while, but this can persist for a long time and always feel kind of stuck until we get in there and really take care of it. What I do find in my clinic is that people coming in with a problem in their spine will always have an SI problem. My theory is that this, again, kind of like the muscle spasms all going around in your low back, where it's protecting it, the muscles around your butt and sacrum go into spasm and it causes a shift. So we take care of this problem here, and then we can get to these problems up in there. So we talked about the sciatic nerve. It's the largest nerve in your body, how it runs down the back of your leg. You might experience tingling or numbness or pain in the leg. It can be a very achy feeling. And when the lower down it is, so if you have pain, numbness, tingling in your calf, the side of the calf, your big toe, that's a more serious condition. I have worked with people who have that, and they do get better with physical therapy. You don't always need surgery for it. When people need surgery, it's usually because the spinal cord is being compromised and it's pretty serious. But other than that, we can help you with a lot of things. It's important to figure out where the symptoms are, what's causing your symptoms. So this is where it's challenging when people go on the internet to just find exercises for your back. On the one hand, there is a lot of overlap where we will do the same exercises no matter what it is. We always want to do core strengthening. However, there are specific exercises that if you have a herniated disc that we would do, but we wouldn't want to do that if you have stenosis. On the other hand, if you have stenosis, there's an exercise we might want to do, but you wouldn't want to do that if you have a herniated disc. And you wouldn't want to do that if you have osteoporosis. So those people who have osteoporosis and stenosis, some of the things that might be helpful to relieve your pain, we can't do because you have osteoporosis. So it's really important to know these pieces. And we don't necessarily need an MRI or x-rays to discern what's going on. Typically, your symptoms and the reproducibility of it tells us what is going on. So what does that mean? Is it reproducible? Someone comes in to me and tells me, my pain hurts when I sit, but not when I stand and walk. I can lay down and not have pain, but standing and walking increases my pain. If I lay on one side, I don't have pain, but if I lay on the other side, I have pain. That's reproducible. So we know that we can actually help you if it's reproducible. So what's not reproducible? 5 years ago, I am one of those fortunate people who do not have back pain. I've been doing this profession for 30 plus years. I did rehab. I've worked in the hospital. I'm a very small person. Those of you have met me, but I know how to use my body the right way so I don't hurt myself. In fact, one of the primary things we learn in physical therapy school is how to protect our bodies so I can help you and I don't get hurt. And so that's when we see you, we are educating you how to take care of your body just like we do so you don't get hurt. And those are in my ebooks. So go ahead and put your email and your first and last name in the chat box, and I will send you those ebooks so you can learn how to take care of yourself during the day. Anyway, so back to 5 years ago, I went out for my morning run and I noticed I had some low back pain in that SI area. And I'm like, oh, well, you know, I was running. It didn't make it worse, didn't make it better. So I kept running, no problem. That was a Monday. By Wednesday, the pain was getting worse and stronger, and it was radiating around to my abdomen. So I had a friend of mine, you know, another therapist, work on me. It helped a teeny bit. That evening, I had trouble sleeping. And by Thursday, I was really super uncomfortable, in pain all the time. Nothing made it better. Nothing made it worse. That evening, I couldn't sleep. I said to my husband, I have to go to the emergency room. There's something going on. This is not reproducible. It's not musculoskeletal. I go to the emergency room. I tell them it's not musculoskeletal. I can't reproduce the pain. It's always there. Because it was my low back, they worked me up for kidney stone, UTI, etc. By 2:30 in the morning, they threw their hands up, sent me home with Vicodin, said it must be musculoskeletal. I wasn't going to argue. It gradually started to get a little bit better over the next days. But by the following Tuesday, remember this all started on a Monday, so this is now 7-8 days later, I reached back and scratched my back, and I had a rash. So I had shingles. I had pain for a whole week before the rash showed up. Very hard to diagnose, didn't cross anybody's mind in the ER. You know, it was unfortunate. I could have gotten the antiviral sooner, but I got it then, and it healed up pretty quickly. So that is an example of I was not able to reproduce the pain because I couldn't, it was just always there. It didn't matter what position I was in. Now, there are some non-traditional techniques that will help when you have pain, nerve pain like this, like shingles, or from chemo. Acupuncture works really nice. And actually some of the non-traditional techniques I do can help quite a bit with the nerve pain as well. However, you know, I needed the antiviral because that made a big difference. In fact, since then, in the last, I've had 2 episodes. I would say 2 years ago, the area was starting to itch. And my doctor said, oh, that's the shingles kind of waking itself up again. She gave me the antiviral and it went away in a couple of days. And then just a few months ago, I had sciatic pain in my outside of my calf. And I had Kevin work on me, and it didn't really help. I'm like, something. And then it hit me. This is the shingles pain again. So I still had some of the antiviral. I took it for a couple of days. And in fact, as soon as I took it, it went away within 5-10 minutes. It was really amazing. Now, with that caveat, I knew where it was coming from. I knew what it was. I was prescribed the medication, but this is not for you to do. So you need to talk to your doctor. If you start getting some sciatic pain that's not going away, it's not reproducible, you need to get in. But if you've had shingles, write this down. Remember to suggest that to the doctor because they may not think of it. It's just not something on their forefront. So what you know is very helpful. The more information you can give the doctor, it's very important. And the same with us. You know, when you come in and I ask you, well, did you ever fall on your head? Did you fall down your stairs? And it could be when you were 5 or when you were 8, but your body is still holding on to some of those problems, and that could be affecting what's going on now. So we want to know all those pieces. I've had a lot of wonderful patients I've been fortunate enough to help, and they've written me some nice testimonials. Denise helped to heal a back injury that had been bothering me for years, and she loved the app and videos that we offer them. This woman wrote that the last time she injured her back, she had to go to PT for 7 months. But when she came in to see us, we got her better within 3, 4, 5 visits. And now she says every time she unloads the dishwasher, she thinks of me because I taught her how to unload her dishwasher and protect her back. So as a thank you for coming today, I offer a free phone call or a telehealth session. So you can discuss what's going on with you, and I can offer my recommendations on what I think you need to do. If I think physical therapy will help. If you have Medicare, you need to get a prescription from your doctor. If you do not have Medicare and you have regular insurance, you can just come in and see Kevin or I without a problem, which is, thank goodness, that's taken a long time to get that direct access. So what is the biggest mistake people make with sciatica or lower back pain? They ignore it. It's always better to take care of a problem sooner than later. Some rest may be indicated, but that's not necessarily going to take care of the problem. You are still going to have the movement limitations that you had before the injury. You're still going to have the weakness and balance issues you had, and they may be worse after you have the pain. So it's very important to come in and take care of this sooner than later. So people might ignore it, and it just goes on for a while. A friend of mine who was a pediatric physical therapist, and now she's retired from treating patients, but now she's teaching little kids gymnastics. Anyway, for whatever reason, she thought she could jump on a trampoline. She's 55 years old. Jumping on a trampoline is never a great idea at 55 years old. And she had some back pain, but she kind of just thought it would go away. 2 months later, she finally contacted me, and she's doing much better now. She had actually, I really thought she had a bulging disc. Her disc was irritated, and we needed to get in there and do some manual therapy to make it feel better. People, when they get severe back pain, they will get to the doctor, they'll get some steroids, they might get injections, and sometimes they'll get surgery before they come to therapy. We really would, it's in your best interest to come in and get educated on how to take care of your back, be as conservative as possible before you do surgery. I think there's a place for steroids, there's a place for a steroid injection, all of this coupled with coming in for some therapy to get yourself stronger, to move better, to balance better, to learn how to not re-injure your back, how to not make it worse. Very important. There is a case for all of these medications, injections, and surgery, but we really don't want that as your first line. I will say that oftentimes when you first acutely injure your back, particularly if it's a bulging disc or herniated disc, you do need some steroids. I've had some patients where they bent over to brush their teeth and wham, the disc went, they fell on the floor. They couldn't even get up and they had to go to the hospital. And so, you would get your steroids, and then usually it settles down after a few days, and then they can come in and see us and we can get them better. So we talked a little bit about what physical therapy is, but what does it really look like when you come in? Well, we're going to talk to you about what's going on, what causes your pain, what makes it better, what makes it worse, your history, your medical history. We want to know all those pieces. We will evaluate your posture, your strength, your mobility, look at your gait, see how you're moving. And based on all of those pieces, we can discern where the problem is coming from and do appropriate treatment. Treatment will be always some hands-on, we call manual therapy, where we really work on getting the joints in better balance, any soft tissue or scar tissue that may be inhibiting you from healing, we're going to work on that as well. We're going to do some strengthening, mobility or flexibility exercises, and stability or balance exercises to get your body working together and stronger, particularly around your core, hips, and feet. A lot of people come in, and particularly my older gentlemen, their ankles are really, really rigid. I don't really know why, but if your ankles can't move when you walk the way they're supposed to, then somewhere else has to move more than it's supposed to, and usually it's your low back, and that is a problem. So we need to get in and work on those ankles and their feet. Hips, everybody's tight in their hips. Women are especially weak in their hip muscles, on the side of their hip muscles and their butt. Men are just really tight there. And as a result, they may overuse their back as well. So we got to get those hips moving. You need to learn how to move from your hips and pelvis and from your core. Those of you probably who do exercise have all heard of your core. Your core are all the muscles from your diaphragm to your pelvis, pelvic floor, and every muscle in between, in the front and in your back. And we need to get all those muscles working together. And when we get those working together, we call that neuromuscular re-education, really re-educating your nervous system, how to move your body the right way so everything's working together. And then the biggest component of therapy is teaching you how to take care of your body. What is the best posture for you? How do you function best throughout the day so you don't keep aggravating it and you don't re-injure? This woman wrote, after withstanding severe lower back pain and an epidural that didn't help, she came here to strengthen her core in order to ease the back stress. And at almost 71, I've adopted their exercises at home. And I can now easily get into the driver's side of my car without excruciating pain and have improved movement throughout the day. This woman said she's had low back pain for 20 years, and twice when it's been severe, she came in here. And the advice, the exercises and gentle maneuvers really put her back on her feet, allowed her to get back to her normal routine quickly and faster than she ever imagined. So she was very happy. So what can you do right now? Make sure you move. Sitting all day long or laying all day is just a recipe for disaster. So get up and move every hour. Set an alarm on your watch to get up and walk around your house and walk extra, just do loops, go around and around 5 minutes. I recommend people walk sideways. We call it sidestepping every time you move. So you go around the house sideways will help strengthen up these lateral hip muscles. Very important. It will help you with your balance and ultimately back pain and anything else that might be going on. Download my ebooks, which I'll send you if I've gotten your email, which will teach you how to sleeping postures, sitting postures, how to lift, how to move throughout your day. So, people do their exercises pretty well, but that takes them, 5-10 minutes, a half hour, and they're using it with good mechanics and good posture. But the rest of the day, they're not paying attention. And that's when things fall apart. Something very important, and, as we get older, we lose some muscle mass and bone mass. And so our balance becomes worse. It's unfortunately and inevitable. It's really important to start building up some habits of mindfulness, of paying attention to what your body is doing whenever you go to move. Okay, and that will prevent you from falling. Okay. Again, if you would like me to talk to you about what's going on with your current issues, you can call, and my admin Jenny will set up a phone call or telehealth session with me. And we can go over what's going on with you, and I give you my recommendations and where I think you need to begin. If you're ready to take care of your issues now, give us a call. We'll get you on the schedule. You'll see Kevin or I, whoever, whatever works best for you. This is my phone number. Take a look at my website. There's a lot of information on there, themanualtouch.com. Sign up for my newsletter. I send out tips every week on how to take care of yourself. And I hope that you decide to come on in if you need it. All right, I'm going to stop sharing the screen and we'll take a look in the chat box to see who might have any questions. Let's see, I've got.
I think I sent you one.
What's that? Oh, what if a patient, I see. What if a patient has both stenosis and a herniated disc? Well, like I said, there are some core strengthening exercises and leg exercises that will be fine for either one, but we probably wouldn't necessarily do the very specific exercise for the stenosis for the herniated disc. We would take a look at that and see which one would work better. Okay, let's see. I've got 1, 2. Rosalind, I need your email. I just have you. Oh, I think you're missing a piece. I got just your name. Any other questions? I should always.
Go ahead.
I should always think about what people ask me when they're here and have a list of them and just answer them. Because if somebody else had it, then you probably would have it. You just don't think of it. You know what's something that is important that I tell people? Some people have so much severe pain that they really can't walk very far, maybe 3 minutes, 4 minutes, because their back starts hurting or their legs start hurting. And then for those people, I recommend that they use a walker or a cane. Some people are resistant and some people are not. The people who are resistant, what I suggest to them is they use a walker at home or use it as an exercise tool. So if, let's say you live in an apartment building, you can walk up and down your hallway with the walker because hopefully you don't have as much pain or maybe even no pain. And you can build up your endurance and your strength using the walker by continually, building up 5 minutes, 10 minutes, 15 minutes. And then you'll probably be able to walk a good 5 minutes without the walker, without pain. So it's very important to use those tools, even though you don't want to. It's also a safety hazard. Safety. I recommend people using it. I get a lot of resistance from people as they get older. They think it makes them look old. They don't want to be reliant on it. People like me who are there to help you, we don't look at it that way at all. We just look at this as something that's safe, something to make you independent. You can still continue your life and enjoy life by using these tools of a walker or a cane if need be. So, any other questions?
All right. Well, if you do, you have my email and you have Denise's email, but Denise is the better one. Definitely set up a consult with her. No other questions? All right.
That's it. Well, thank you so much. I think I'm doing another one next month, or
I was just going to get to that.
Oh, okay.
Yeah. All right. Thank you for this concludes our YMCA education series presentation on behalf of the North Suburban YMCA and the YES series. We thank you for your time today and listening to Denise. Thank you again to Denise for talking to us. Denise will be presenting next month, June 16th, Thursday, June 16th at noon, about heals. Heal your heel pain naturally, and heal your heel pain and enjoy life again. So we look forward to hearing from Denise on June 16th at noon. And then also our next talk is next Wednesday. We're talking about sports medicine for all ages. So if you play pickleball or anything like that, that's outdoors and moving around, it sounds like they'll be able to talk a little bit more. That is Wednesday, May 25th at 7 p.m. This is our IBJI talk. All right, and so thank you for everyone joining us today. Programs like this are free and open to the public. We encourage you to support. Visit our website, nsymca.org, and otherwise, we'll see you hopefully next month, June 16th for Denise. Thank you again, Denise.
Thank you so much, everyone. Have a good day. Enjoy the weather. Bye.
Bye.